First of all, I guess tell me a little about what you learned today about Crescent, and I know they've got a lot of big plans for the future.
Yeah, I think number one, what I would say is I'm so impressed with number one, the facility, but also the staff here. They truly have a continuity of care approach to how they're treating patients, and I think that's so important, especially when you're talking about vulnerable populations of patients. So, not only the Marshallese community, but the Hispanic community and people who might be skeptical about seeing a provider, having that developed relationship, I think is really, really important when you're looking at the full care model. Down to the facility here for physical fitness, nutrition, dental, everything. It's a full spectrum care, and I think it's just impressive what they're doing here in the community.
Have you heard much about Wellness Coalition? I know they're eager to be able to offer vaccines, anything else?
Yep. Well, I think that's number one priority right now is making sure we can get that vaccine out, and so talking with them about how that can be administered really effectively through their care model here. I'm very excited about that, and I hope one of the things that our office will be following up on is advocating for Crescent and other federally qualified health centers in Iowa to be able to administer that vaccine, because when I look at the coverage area of the counties that they draw in to serve, those are areas that they need access to health care. They need that vaccine. Rural Iowa has had challenges in accessing the vaccine, and then you add income-based challenges on top of that, transportation-based challenges on top of that. That's where I see Crescent being a vital part in making sure that we can get that health care to people who need it. Dental care, that's another thing that we were talking about, like their approaches in expanding their dental care going forward. So all of those things I think are exciting to me as I'm going to go out to DC and work on these issues. I asked them for specific examples from patients, about what that care has meant to them, because I think that's really important as I'm going to bat for our federally qualified centers here in Iowa. I want to make sure that I can say, look, here are the actual patient outcomes that are productive and show hey, if people are following through and they have this care model, it's effective, and ultimately that reduces costs and it gets people the care they need. So I think it is a win-win that way.
Where are we in the whole process toward an next relief package? I know.
I think a couple weeks out, obviously the reconciliation bill moved through last week. It's now down to the committees. We had our first budget committee meeting this week. I think it was yesterday, actually, now that I'm thinking through my week. So, obviously those will be moving through the process in the next couple weeks. It sounds like maybe not this package, but the next package we'll be able to offer amendments and actually, really engage more as a budget committee in that process. So I'm looking forward to that. Because unfortunately, in having this conversation here today, we all realize that this is not over anytime soon. And so a lot of this planning is really thinking 6 months, a year down the road, how can we continue to provide resources so that we can combat this pandemic. So that's definitely why these conversations are important to be having right now, because 2 months from now or 3 months from now, when we're dealing with the next reconciliation package, I can come to the table with real data from what they saw in 2020. 750% increase in telehealth is what they're saying in 2020 through the health centers in Iowa. So that's significant, and it clearly shows we as policymakers need to be adapting to that and providing funding as such so that those services can continue to be available.
Obviously, there's been some interesting discussions in the House, especially with the majority's decision to remove Congresswoman Green from her committee assignments. What's the temperature like following those decisions, both in your caucus and in your caucus as a whole? So we look for places to come together.
Yeah. No, and that's absolutely a priority of mine. And I think, coming out of last week, the last month was pretty tumultuous month on Capitol Hill. So from my perspective, what we were all trying to do last week was say, okay, we need to move forward. And I think it was unfortunate that they chose to do that for something that she said before she was elected to Congress. And I said it last week too, and I believe that I'll be the first to help hold her accountable if it's a problem going forward. But we have to have an improved culture in the halls of Congress for us to do the best work for the American people. And so that's the attitude I'm trying to bring to the table. And I want to focus on actual policy and and getting our federally qualified health center the money they need, not on all the partisan bickering that's happening. So that's my focus going forward, and I think that there is a general attitude shift toward that going forward.